continue a rapid spread. The CDC announced yesterday that the quarantine time for people who test positive for the virus would be cut in half from 10 days to 5 days. 13 News' William Ingalls talked to hospitals in the area about if this change brings much needed relief for their staff and whether the shortened quarantine time is safe.
It's no secret the last month has been brutal for hospitals caring for an overwhelming amount of COVID patients.
In midsummer, we were averaging anywhere from as low as one patient to single digits, and now we've been on a normal basis in the mid-20s to 30 as far as positive patients that are admitted in the hospital.
And those cases have caused hospitals to lose valuable staff for more than a week at a time.
We have a number of staff that have tested positive in the last couple of weeks, as we're now seeing the Omicron variant hit Winnebago County.
But after 2 years of fighting COVID, healthcare systems get a break and can get employees back twice as fast after a positive COVID test.
It's not going to fix things, but it's certainly much better than being faced with having an individual out for 10 days when they're perfectly capable and willing to come back to work.
But Dr. Stephen Bartlett with OSF St. Anthony wants to make it clear that the decision isn't based on a worker shortage, but growing data that a shorter quarantine time makes sense and is safe.
The decision to, reduce the time that you need to be on isolation really relates to the fact that the biology of the virus is that it comes and goes faster than we originally appreciated.
Bartlett says there are some protections and guidance for people who do come back in that earlier 5-day window, like wearing a mask, which is supposed to guard against a lingering cough that's common in some COVID cases, even if that cough is no longer capable of spreading COVID-19. For 13 News, I'm William Ingalls.
Thanks, Will. And while both Bartlett and Mark Gridley support the CDC decision, they both say the only way to really put an end to the spread of COVID is vaccination and staying up to